Imagine, if you will, severe pain that runs down half of your brain, down your neck, into your shoulders, feeling pain through what feels like every single hair on your head, pain running through your jaws, pulsating into your teeth, unable to lift your head because your head hurts so bad, unable to open your eyes due to severe sensitivity to light, unable to eat because you're so nauseous. Now imagine that pain for no less than 24 hours. Imagine no medicine in the world being able to take that pain away. That is what I go through every time I get a migraine. I'm not alone. I am one of 29.5 million people who suffer from migraines, according to the National Headache Society. I will now explain what a migraine is, why migraines happen, and what treatments are available. I will start by describing what a migraine is. Migraines are very common, however, doctors do not know much about them. A migraine is a genetic condition that is often misdiagnosed and goes untreated, according to the Mayo Clinic staff. Migraines are often passed from parent to child, and women are 3 times more likely to suffer from migraines, according to Stuart J. Temper in Understanding Migraines and Other Headaches. Migraines are more common in lower socioeconomic classes and cost an estimated $10 billion per year in lost labor in the United States alone, as stated in Understanding Migraines and Other Headaches by Stuart J. Temper, MD. The criteria for a headache to be classified as a migraine, per the International Headache Society, as described in Understanding Migraines and Other Headaches by Stuart J. Temper, MD, is as follows. Patient must have had at least 5 migraine headaches. The migraines must last from 4 to 72 hours. The migraines must be pulsating or throbbing in nature and or located on one side of the head. The migraine must be moderate to severe in intensity and inhibit or prohibit daily activities. The headache is worsened by routine activities such as bending over or climbing a flight of stairs. The headache must be accompanied by nausea and or vomiting, sensitivity to light and noise, and the patient may have auroras, dots, zigzags, or crescents in their sight of vision prior to the onset of migraines. This is what a crescent aurora looks like. Sufferers can experience migraine symptoms before the onset of a migraine, either hours or even days before the migraine. Those symptoms include aching joints, severe thirst, restlessness, fatigue, food cravings, and mental changes such as euphoria or depression. Symptoms can also occur after a migraine, such as disorientation or nausea. Since we now know what a migraine is, I will tell you what might cause migraines. Although migraines are common, no one is quite sure why we get them. Migraines are believed to be caused by internal and external factors. The internal factors include neurons, nerve cells, that discharge through the nervous system too easily, and in turn they initiate the pain and the symptoms associated with a migraine. It's also believed that low levels of magnesium in the brain, which allows the nerve cells to fire off, could be another reason why migraines are caused. Ovulation or menstruation is also believed to start migraines. Most gynecologists believe birth control can help prevent migraines, while neurologists believe they can worsen or trigger a migraine. External triggers for migraines include food, either not eating enough or not having a well-balanced meal, different heightened stress levels, changes in the weather, barometric pressure mainly, changes in sleep patterns, or birth control. Often women do not get headaches during pregnancy or after menopause. However, that's not always the case. Some women get more headaches and migraines during pregnancy and menopause. Now that we've discussed what could cause a migraine, let's look at the available treatments. An assessment of the level of severity of migraines should be made before deciding upon a treatment regimen. A headache diary should be created to track the intensity, length, and any potential triggers. If there's no family history, a doctor may run a CT scan, MRI, or even a spinal tap to ensure there are no underlying medical problems. Medicine is the most common treatment for migraine sufferers. Low-level medicines do not require a prescription but will only treat the mildest form of migraines. Severe migraine sufferers will not be able to feel relief from over-the-counter prescriptions such as Tylenol or Excedrin. Mid-level medications require a prescription but are not costly. Mid-level medicines do not activate serotonin receptors, which stop a migraine and cannot relieve pain and symptoms associated with a severe migraine. Most mid-level medicines have blood vessel constrictors and mild muscle relaxers. For severe sufferers, doctors will prescribe stronger medicines with barbiturates, caffeine, stronger muscle relaxers, and sometimes narcotics. These are the most expensive prescriptions to get. There are many non-medicinal treatments as well. Non-medicinal treatments include chiropractic therapy, the realignment of the spine in order to relieve any stress on nerves in between your spinal cord. Acupuncture, where a doctor places needles in specific parts of your body in order to lessen the blood flow. Lifestyle changes such as better sleep and regular exercise are also believed to relieve migraines. Massage therapy, yoga, and muscle relaxation techniques are believed to relieve stress from the body. Magnets, homeopathy, and herbs are the last of the treatments I'm going to discuss today. Although they are believed to relieve migraines, there's no scientific proof behind them. You now know what a migraine is, why people are believed to get migraines, and many different ways to treat migraines. Migraine causes serious pain for millions of people of all races, ages, and sex. Although there are many forms of treatment for migraines, there's no current treatment to get rid of the disease for good. As I stated earlier, I suffer from migraines. I have gone to a chiropractor. I've tried over-the-counter prescriptions and at least 4 prescriptions from my doctor. I've tried to change my eating habits and try very hard to get at least 7 hours of sleep each night. The medicine I take now does not always get rid of my migraines. I miss at least 4 days a year at work due to migraines, not to mention the missed birthday parties, vacations, and other ruined social events that I can't attend because I can't bear the pain. I hope the medical field continues to research the causes of migraines so we will not suffer and miss out on enjoying our lives. Does anybody have any questions?
I do have a question, actually, a two-part. How long have you been suffering on migraines, and what have you found to be the best treatment?
For over 10 years. I started getting them when I was about 19 years old, and I'm 30 now. I try to exercise. When I exercise regularly, my migraines seem to be fewer and far between, and I try to get enough sleep, and I try not to let stress get to me. Thank you for your time.